Some shows that I do are just really very difficult to do as a parent, as a father, as just a human being. And today is one of those shows. It is the absolute unthinkable. We're talking about harming your own child just so you can get attention from a doctor, just so you can feel important. It sounds unimaginable, as a parent's instinct is to protect their child. But for people with a psychological disorder called Munchausen's by proxy, they actually make their own child sick in order to fulfill a disturbing need to get medicine, to get sympathy, to get attention, to feel important. You're about to see parents caught on tape actually causing their child harm. Now, I want to warn you that this footage is very graphic, so I want to take a second and ask you to have your children leave the room if they're there, because this is not for their eyes, this is not for their ears, so please take a beat to get them out of the room. Take a look. Munchausen syndrome by proxy occurs much more than we realize. Munchausen parents will attempt to smother their children. They will put harmful bacteria in their feeding tubes to make the children sick. This mother is trying to make her child vomit by gagging the child with her hand. They will use whatever they can, including their bodies, to smother their child until the child loses consciousness. All for the attention it will draw to them. Here is a child who is about to be suffocated by the one who gave her life. She can't cry out, can't tell anyone what is really going on. Now, we're going to look today into the mind of one woman convicted of trying to harm her daughter Elizabeth by constantly keeping her sick. Now, we're talking to all sides of this story. The woman with Munchausen's, Tracy McHugh, who was convicted of abusing her children. We're also going to talk to the detective who says this is the most disturbing case he's ever investigated, and the doctor who first suspected Tracy had Munchausen's. And then there's Heather, the daughter who survived years of this abuse. And finally, her Aunt Jessie, the woman who put the first clues together and brought Tracy to justice. Take a look.
It makes me so mad to think anybody could hurt a child. I can't comprehend it. The longer I knew Tracy, the more I knew that there was something very terribly wrong. Tracy claimed that her daughter had von Willebrand's disease. It is treated like a hemophiliac. She took a lot of medication. She would have to go to the hospital for bleeding problems. Heather had an IV port hanging out of her arm. Tracy told us that Heather needed the port so she could give her medication. Heather had come over to visit. She was on crutches. Her mom claimed there was fluid or something in her knees. She was there 5 minutes in my home, put her crutches on the floor, and ran off to play with my children. I had a very hard time believing most of what Tracy was saying. She didn't act that sick. She didn't look that sick. I told my husband that I believed Tracy had Munchausen syndrome by proxy. I was upset because I couldn't stop it. I couldn't prove it to tell anybody. We found out that Tracy was pregnant.
Heather was 16 when Tracy had Elizabeth.
Tracy told us we would not be able to see Elizabeth because she was sick and needed surgery on her stomach. It was almost 10 months before I was able to see Elizabeth.
Who's that? Is that Elizabeth?
I cried. She was the most beautiful little girl.
Hi, baby.
She was so tiny. We were just so happy to finally see her. I wanted to take her home. I was very scared. I honestly thought something was going to happen to her. Every time Tracy would tell me something medically was wrong with Elizabeth, I would cringe inside. I was outraged. We knew it was happening again.
Tracy's behavior was appropriate, but as we get to know her more, it appears too normal, too polite, too attentive, and gaining a lot of attention from the staff seemed to provide her with a lot of satisfaction.
Joseph was born a year and a few days after Elizabeth. Tracy said that she didn't tell anybody that she was pregnant because the Department of Children and Families were involved with an incident with Elizabeth. They had a report she had a fractured rib. Tracy delivered Joseph at home in the bathtub by herself. Tracy had him tested for the von Willebrand's disease and said that he had had respiratory problems. I was freaking out at that point. I knew something had to be done, and if it wasn't done soon, something was going to happen to these children.
We started videotaping. We wanted to see if we could catch her doing anything to the kids.
One day, Tracy asked if I would go to the hospital with her. Tracy had said that Elizabeth was vomiting. She had diarrhea. She had blood in her stool. She had a high fever. She had red blemishes on her body. The doctor said, "There's nothing wrong with your baby. Take her home." At that point, I was so happy. I was jumping up and down inside. I was finally relieved to know I was right. Tracy didn't want to leave that hospital. She wanted Elizabeth admitted with a feeding tube. And that was when I realized I needed to report her. I didn't have any proof that Tracy was doing anything, but I knew that she was doing something and those kids weren't sick. Elizabeth was admitted to the hospital finally. Tracy's persistence, and she got her feeding tube.
They put the feeding tube back in her. She lost a lot of weight.
She called me every day to give me an update of Elizabeth's status.
Elizabeth had the symptoms that were caused by something, but the vomiting, the diarrhea did subside when the mother was not around. I alerted the nursing staff to help me. They provided me with hour-to-hour supervision.
Tracy was claiming that Elizabeth was sicker and sicker to the point where she was almost ready to die.
Once I suspected Munchausen by proxy, I proceeded to discuss with social services. The court granted me a 2-week period where I could observe Elizabeth on my own without any interference from family members.
One day, the Department of Children and Families came in and approached Tracy with the accusations of Munchausen syndrome by proxy. Tracy let me know that DCF had taken the children from her.
Tracy was arrested on August the 4th. I believe Tracy was genuinely surprised. I think that she had thought she had tricked all of us or convinced all of us that she had not done anything wrong.
I think that the best thing that could have happened was to take Elizabeth out of Tracy's care, which most likely could have resulted in her death.
Tracy was convicted of the single count of aggravated child abuse.
My husband and I took Joseph and Elizabeth. The caseworker handed me Joseph. I hugged him, I kissed him. I called my husband and I said, "I got him, he's home." And I just waited for Elizabeth to get discharged. She belonged safe and with people that were gonna love her and not abuse her.
Well, Jesse, welcome. Detective Rose.
Thank you.
These are very difficult cases to prove.
Yes, sir, they are.
And there's a lot of doctor hopping that can go on. What tipped you off? What was the first thing that made you say, there's just something not right here?
There wasn't just one. There was a couple things right in a row of the span of illnesses that was claimed for Heather, and it didn't make sense.
Now, we're going to take a break and come back and talk more about this. And next, the young girl who endured her mother's Munchausen by proxy abuse and more shocking secrets uncovered when she revealed to police that her mother buried something in the backyard. Tracy McHugh is a mother who tried to make her own children sick so she could have attention from doctors. It's called Munchausen by proxy or Munchausen syndrome by proxy. Now, Tracy's oldest daughter, Heather, is here. She survived years and years of this abuse. She took her to almost 400 medical visits, over 100 days of her life spent in hospital beds, needlessly. Take a look.
I was not sick. Tracy, my mom, made me sick. Mom made me eat stuff that if I drop it, I have to eat it. I'm thinking she put like something in our food to make us sick. I did get sick after I ate the food. My mom did hit me a lot. She used to spank me for no reason, for nothing. I remember coming home, I ran outside and we have a back garden. She was digging a hole. I was like thinking in my head, why is she digging a hole? I'm like, Mom, I have a report card and I have good grades. She said, go inside and do your homework. So I did. I took my dog outside to play with me. She was nowhere behind the tree or in the shed. I see dirt flying and I'm like, Kenny, where you from, girl? Dig a little bit more and I found a baby. The baby was a girl. She had brown hair, brown eyes, looked like me. The baby was still crying. The dirt kept on going through her mouth and filled all the lungs up and died with her eyes open. I wrapped her back up, bared her back, went back inside. I was in tears. She said, why are you crying? I said, whose baby did it belong to? She said, it belonged to my friend. I said, tell me the truth. Then she told me the truth. She said it was mine. I didn't tell nobody. I kept that whole entire secret to myself for years. So I wanted to tell Pam about it. She convinced me to tell an Officer Rose.
In September 2006, Heather told me, Detective Rose, I need to talk with you. I need to tell you something. I remember something about my mom. When I was real little, I found my mom burying something in the backyard. She said it was my baby sister. After the interview, Heather agreed to drive over here to the old address, and this is the house on the corner right here. She pointed right to the shed here and said that's where she's buried. I asked to have Heather come up and see if she could actually pinpoint where the body was buried. I took her by the hand and we walked back there, and it was a real emotional moment, you know. We went out to the Polk County Jail and Tracy agreed to speak with me. I pointedly asked her, I said, Tracy, is there a baby buried in the backyard? And almost immediately she began to put her head down and she began to cry. She says, it's been so hard, it's just been so hard. And she said, yes. She said the baby was born alive and crying, and at some point the baby stopped breathing. And she panicked and buried the baby in the backyard. Well, I showed Tracy this map of the property. I said that we were digging in both this area and this area. Tracy corrected me and said the baby was actually buried right here on the other side of the shed. They shifted their digging efforts over to there, and within a half hour they found the baby. She'd been wrapped in a blanket in plastic bags. They were skeletal remains. Our medical examiner never determined it was the baby. It was a girl. He was able to date the remains 9 months, but again, no sex or weight or anything like that. She wasn't charged because the physical evidence was not there for us to pursue. Her statement was that the baby was alive and breathing, and then the baby quit breathing and she buried it. Whether that's true or not, we'll never know. I went to Heather and I told her, I believe that you have the right to name the baby. She eventually decided on the name of Abby Lynn McHugh. She told me that she recalled it being a girl, and so we buried her.
How do you feel about all of this at this point? Your mother, your biological mother, is in jail. She has been convicted of doing all these things to your sister. We know from your reports and everybody else what she was doing to you at the time. How do you feel about your mother at this point?
I do love my mom, but I really don't have nothing to say about her.
Do you feel safer knowing that she is away?
Yes, sir.
Yeah. And you have no contact with her at all because she's been ordered no contact with you.
Yes, sir.
As difficult as it is, I'm trying to figure something out here. You saw your mother digging in the backyard, right?
Yes, sir.
And your dog actually found this spot and started digging.
Yes.
You pulled that baby out of that grave
Yes, sir.
and held it in your arms.
Yes.
And the baby was breathing
Yes.
and crying.
Yes.
So she buried that baby alive,
Yes.
and it died in your arms.
Yes.
That's how you remember this. I absolutely hate that you had that experience at that age or at any age, and every person in this room and at home right now is absolutely horrified. Do you remember all of the doctor visits that you had to go to, all the hospitalizations, all the things that you went through?
Some I do and some I don't.
Did you ever say, I'm not sick, I'm okay, leave me alone?
Yeah.
And
Lots of times.
And what happened?
And Tracy said that you need to go, I need to take you to the hospital because you're sick. But, which it wasn't true.
And you live with Pam now. Pam, Tracy, her mother, actually babysat for you
Yes.
much earlier.
Yes. Before Heather was ever even born.
Right. I'm about to show an interview that I did with Heather's mother, Tracy, who is in jail right now. Now, part of Tracy's sentencing was that she is to have no contact with any of her children. I'm going to ask Heather, I'm going to ask you to go backstage. Next, I am going to speak with Tracy McHugh, the mother with Munchausen's by proxy that is convicted of child abuse. We're going to find out why she still believes that she did absolutely nothing wrong. Munchausen by proxy is a very sick and twisted disorder where a parent actually harms their own children, exaggerates their symptoms, does anything they can to get attention from doctors and hospital staff, and therefore feel important because they're a focus of attention, sympathy, and support. Now, I just sent 19-year-old Heather backstage so she will not hear her mother. Now, there is a no contact order as part of Tracy's sentencing, so we have to send her backstage, and then we'll be able to bring her back out later. Now, Tracy called me from jail, and listen very carefully, because you're going to get a chance to see inside the mind of this woman. Tracy?
Yes, sir.
It's Dr. Phil. How are you?
I'm doing okay, sir.
I'm very glad to talk to you. Well, let me ask you some things about what got you in conflict with the authorities to begin with. When you were sentenced, did you believe that you had Munchausen's by proxy?
Honestly, no. I still don't know. You know, I really don't understand what it is. My kids were sick.
So as you sit there today on this call, you still believe that these children were sick and that you were doing what was in their best interest?
I mean, I was doing what I think was in their best interest, yes.
Between 2001 and 2006, you took Heather to the doctor 384 times. There were 7 hospital visits that lasted 15 days.
Yes, because of her, she had ITP. Well, for 3 months, septic meningitis, parvovirus B19, an enlarged spleen, and enlarged liver.
How did you feel when the experts in court testified that she, in fact, had been abused?
It was hard. It was very hard.
Did you abuse her?
No, sir. I never, I mean, yes, I had done things to my kid that I'm supposed to because I was trained how to do it. Like her von Willebrand disease, you have to give her medicine, you have to give her faster. And I was taught how to do it.
Well, how did you abuse them?
They said I took her to the doctors and hospitals too much.
Tell me what your understanding of Munchausen's is.
I like the attention. I'm supposed to like the attention. I like torturing watching my kids torture, and I get the thrill of it. And the other part of it is I make things up, and it's not true.
At this point, you have lost all access to your children, correct?
Correct, sir.
How do you feel about that?
Devastating.
Heather, for example, if she's watching this, what would you say to her?
I'm sorry that I wasn't a good mother to her. I'm sorry whatever I did to her.
Do you think you did something wrong with her?
I honestly don't know. I don't see it myself, but I know what I did, what I had to do with my kids.
Did you cripple these children by the way you treated them?
I don't see it, no, sir. But I don't know.
Is it possible that everyone is correct, that in fact you do have this Munchausen syndrome by proxy, where you instigate, exaggerate, fabricate all of these different diseases in order to get attention yourself?
Okay, if I did that, then my children would not have, Heather would not have two diseases that she does have.
Well, even if she has two diseases, I mean, doesn't it seem strange that you took her to the doctor almost 400 times?
With the von Willebrand disease, because she has to have blood.
Do you know that all of your children have improved in their health and well-being since they got out of your care?
That's what I heard, yes, sir.
How do you feel about that?
You know, Heather's older, and she's gotten stronger. Elizabeth, I told her that, and everything I've been telling them has been right with Heather. She was weak on the left side. But after I get done, when they take my children away, take Elizabeth away, she still had health problems after I left, because I have documentation what has been wrong after they left. But she got stronger.
I understand that you gave birth to a child somewhere around 1996 or 1997 and wound up burying the child in the backyard.
Yes, sir.
Does that seem strange to you?
The circumstances, I panicked.
Were you aware that your daughter says that she knows that that baby was alive and that when you buried her, she was alive?
But it was not, and it was proven, and it was not.
And that would constitute murder?
I know.
Did you murder your child?
No, I did not.
How old was the baby when you buried it in the backyard?
When it came out.
It was immediately after birth?
Yes, sir.
It was alive when it was born?
No, it was not.
You're saying it was a stillborn?
Yes, sir. It was not breathing, yes, sir.
Did it occur to you to call the ambulance, to call the emergency room, to do something to try to help the baby, revive the baby?
Sir, I was scared.
Some 6 or 7 years later, you gave delivery to another child in your bathtub, correct?
Yes.
And you buried the placenta in the backyard.
I didn't bury it.
Who did?
My friends did.
If you truly believe that your children were subject to being ill and subject to having diseases, why would you take the risk of having births at home without having the proper care around?
I did. I took my vitamins and everything.
Do you want to have another baby?
I do, and then I don't know. I do.
Well, you know, I'm very reluctant to tell people what I think they need to do about their families, but I'm telling you, if you ever hear anybody, hear me when I tell you, don't have another child.
So you know what an empty void feels like.
An empty void is not to be filled by another person's life that you put in danger. Do you agree? She's out. We've lost our connection. I had 15 minutes to talk to this woman. I am most troubled by our last series of questions when I was telling her, you certainly don't want to bring another child into this life. You heard her say, but you don't know what it's like to have such an empty void. It's clear to me she has a longing inside. It's clear to me that she intends to have another child, and I am so troubled by her lack of insight, her lack of willingness to acknowledge the facts and the data, and that is tantamount to what we do know about Munchausen syndrome by proxy. But it sounds to me that she intends to continue that pattern and continue to try to get that attention, try to fill what's empty in her by somebody else. Dr. Reinstein, how do you react to her saying, I got an empty void, I just want another baby?
That's very typical of Munchausen, the lack of insight. I'm not a psychiatrist or a psychologist, but as a medical professional, we cannot stop but be amazed and disgusted by this behavior.
You were the one that first ran the flag up in the hospital and said, we got to watch this lady. And let me tell you, I believe you're doing so saved that child's life. And God bless you for having the strength to do that. I mean, is there anything legally that can be done to stop this from happening again?
Well, you mentioned the court order that came down during her final judgment and sentencing, and the order also includes no contact with children. If she became pregnant, obviously her probation officer would find out about it. She's had a history of hiding her pregnancies, but at that point we find out she's pregnant, Department of Children and Families in Florida would be involved, and they would most likely take the child.
After talking to Tracy, I've got to tell you, I just have even more questions about this buried baby and why it was kept a secret for 10 years. Many people refer to Munchausen's by proxy as a disease. Now, it's a disorder that is very controversial, so much so that some parents are falsely accused, which you can see on a documentary called Mama, which is very compelling. Now, we spoke with Tracy McHugh from jail. She has been diagnosed with this disorder and convicted of child abuse. She gave birth to some of her children at home. Another, she claims, was stillborn, and she buried that child in her backyard. Now, the problem is when the baby's remains were found, they were skeletal remains, right? So
yes,
there
sir.
was no ability to have a determination of even sex, let alone cause of death, right?
3 separate examinations of those remains. We couldn't determine anything like that.
All right. Isn't it true that Tracy told you this years ago, one night when she was drinking?
Yes, but I didn't believe her because she was known to tell lies and say other things.
You were seeing her like she would always have to one-up another parent. She had a feeding tube. She had strapped an IV tube onto the baby. I mean, there was just so many bizarre happenings that did it seem at the time that with all this behavior that certainly could have been true?
Once Heather told me, I believed Heather.
Did you believe her when she told you, Heather?
Absolutely.
Did it seem like a credible report to you?
Yes, sir, it did.
I guess what I'm trying to figure out is if this child found that baby, or if this is something somebody told her and she reported it.
Yes, sir. I think that's certainly a possibility as I've gotten more into it. As it's come along, like today I heard Heather's story change a little bit about actually the baby being alive at the time she dug it up. She didn't disclose that to me back during the initial interview in September. And I'm wondering now where these memories are coming from, whether they are genuine or whether, Pamela may have said something to her. I don't know. But I believe that Heather needs some counseling to really kind of figure this out and make it make sense to her.
You never brought this up to Heather over the years in any
No.
way? You didn't report this to her and ask her to report it to them for fear that you might get in trouble for having not reported it when you heard it? She clearly needs help and counseling, no question about that, and we're going to do everything we can to make resources available to her. We're going to delve more into this Trista story when we come back. We're going to talk to an expert on Munchausen's and find out if there's anything more we can understand about this. Well, today we're talking about a very disturbing disorder called Munchausen's by proxy. Now, when a parent does intentional harm to their own child, it is clearly unhealthy, it is clearly sick and twisted, and we're trying to understand that. I'm not only concerned about what happened to those children then, but what is happening with them now, what's going on in Heather's mind. And that's why I say I certainly agree, Detective, that she could benefit from some counseling. How are you doing with Heather at this point, in your opinion?
It's very hard with her. Heather had regressed a lot through it all, but as times went through, she's gotten better with dealing with things.
One of the most unusual statements I've heard in this whole situation was when you said to our producers in an interview, I wonder if I'm guilty of doing the same thing as Tracy.
It makes you stop and look at yourself as a person. It really does. To stop and say, well, you know, am I going to put myself in the same shoes she was? But I mean, it does make you stop and take a look at yourself and to know that you don't do that to your children.
Do you have any concern as we sit here today that you are not in control and could have or might lapse into the sort of things that Tracy was doing?
No.
Jesse, would you want to say anything?
I know that Heather's doing better since she's left her mom, and Pam hasn't had to take her to any doctors. But I would definitely like to see Heather get some counseling, and possibly Pam. Because Pam's been through listening to all this, and for her to work out what she's going through and to help learn how to deal with Heather.
Well, we want you to have all the support that you can, and I think it is a courageous and generous thing that you've done to step up and be there for that child at the time. But if you think there's anything that's getting out of control, I want you to tell me and let me help you with it.
I would like to see
I don't want
Heather,
to be mad at you about it, I want to help
Right.
you with it.
I would like to see Heather get some help to sort through things, to understand how she remembered and just to remember where it come from.
You've watched this closely. How do you think Heather's doing?
Well, what I saw initially was a surge in her health and her personality and just everything about her. Just a beautiful young girl and doing some well. I don't mind saying it. I've had some concerns lately about the family situation, about everything across the board because of the counseling. And Pam and her husband and her family, like you said, have stepped up and have really taken on this responsibility. But I think even Pam making that statement, her reflecting on her family and her situation, I think it's a good thing. But I think Heather could benefit in the entire family. It's impacted the entire family. It's impacted our entire community. So I've had some concerns about Heather being there for now because I think she's capable of so much more. And I think that she needs to have some other resources to kind of help her grow into the young lady that she can.
We have an expert here today that has written extensively about Munchausen's and has some things to say about it. We're going to talk to her and see what the warning signs are, see what to look for, how to know if something's going on with somebody in your family or even yourself when we come back. Munchausen by proxy is when a parent harms a child for the sake of gaining the attention that comes from it. Now, joining us today is Dr. Judith LeBeau, Director of Psychological Services at Children's Hospital, Oakland in California. And she is also the author of Hurting for Love, Munchausen by Proxy Syndrome. Doctor, thanks for being here.
Thank you.
Talk about how they get away with this. I mean, because they actually really ingratiate themselves with the healthcare professionals, right?
Some 85 to 95% of the people engaged in this are mothers, unfortunately. They tend to be very good imposters at looking like the ideal parent. They impress people often in healthcare centers in terms of being devoted to their children. They're very good liars, unfortunately, in many cases. They have long histories of deception. They're very medically knowledgeable. They use terminology. They seem devoted to their kids. They're seemingly doing the right thing in terms of bringing their children for medical care. And the way doctors often don't see it or get caught up in a relationship with this parent in a way that makes it very difficult for them to challenge the parent or sometimes to even see what's going on with these moms.
What's the prognosis for these folks?
Well, unfortunately, treatment has not proven to be very effective in many cases with these moms. In fact, denial as we saw on the tape with Tracy, tends to be the predominant response of these parents, even often when found on videotape actively harming their kids. They tend to continue to insist that they are not doing this, that they're being misunderstood, that someone is setting them up. So what you need to start with is a parent willing to even acknowledge that this is happening.
Yeah, and Tracy clearly wasn't. I mean, you heard me talking to her. I mean, overwhelming data. She just like, and yeah, I want to have another baby because it's a huge void. I want to introduce Elizabeth. She was the latest victim of Tracy. So how are you doing?
Look, Daddy's right there. Say hi, Daddy.
Daddy right there? Pam and Jesse have stepped up and taken in Tracy's children, and we're going to make any and every resource we can available to help support you guys in what you're doing. Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.